Spas.
Welcome back. Well, there are a spectrum of treatments to help manage pain.
Yeah, no pain management medicine can help pinpoint your source of pain and relieve it without surgery or dangerous narcotics. Dr. Danish Mezalundus is here to tell us how it works.
Good to see you, Doc.
It's good to meet you guys. Good to see you.
All right, a lot of people these days, doctor, are having especially lower back pain.
Absolutely.
So is it something we just have to live with, or do we have to just always be taking a pill for this?
No, absolutely. You know, it's interesting. If you go back a few hundred years, we always sat on the floor and did things that were healthy for our back, kept it strong. But we don't, you know, we've evolved. We get to sit on couches and sleep in beds. Exactly.
Yeah. Okay.
So it's very natural for the back to start to ache, and it's just a normal degenerative process.
So what are the options for people who are maybe having chronic pain?
Yeah, there are actually more options than people realize. Everybody thinks about, you know, surgery or taking pain medications, but really there are a lot of better options out there. And what we do is try to figure out the specific structure that's involved in your back pain, or, you know, whatever pain you have, because it's often understanding that where we can help incentivize the body to really fix itself.
So is the ultrasound the tool that you
right,
use?
so this is one of the tools that we use, and this really allows us to kind of visualize inside the body. If one of you guys want to volunteer, I can.
Sure, do you? Go ahead. What?
You show your back.
What am I doing?
Well, I can look at your wrist.
Look at my wrist.
Okay, your wrist.
So a lot of people, for instance, have carpal tunnel.
Oh.
Sure.
And with this, we're able to actually visualize the carpal canal. I don't know if you can see that.
That's beautiful, isn't it?
And if you move your fingers, you can actually see the tendons in there.
Oh my goodness.
So we're able to see things in real time.
I'm like a Greek god, aren't I, Doc? When you looked at ultrasound, was that amazing? What a physical specimen that was.
Most beautiful wrist I've ever seen.
Hey, thanks.
Wow. So, and you'll do this on whatever part, I guess, of the body a person is
So for instance,
about?
yeah, like let's say you have shoulder pain, we can figure out specifically the tendon that's involved in your rotator cuff.
Yeah.
And a lot of times we can treat it medically so that the body fixes itself.
So when you say medically, are we talking about deadening nerves, or what are we talking about?
It's a spectrum of things that we can do. We can numb nerves, and that sometimes that in and of itself is enough to kind of reduce the inflammation and incentivize healing.
Physical therapy is involved sometimes?
Physical therapy is definitely involved.
Strengthening?
And we can visualize the things that need to be strengthened and help your physical therapist better target it.
And I guess that's the better route to go before full-blown having to go through a surgery.
Invasive
or something.
stuff.
Yeah, I'm close friends with a lot of surgeons, and we have a very close relationship in trying to prevent people from needing surgery, and then if inevitably they do need it, then we're able to.
Let me ask you this, because a doctor once told me a good rule of thumb is that patients who may want to come to you is if you're not suffering chronically all the time, but it's, you know, intermittent, surgery is not a good option, because surgery never fixes things that aren't chronic. So maybe they should look to you or your options first.
Absolutely. Yeah. I would recommend, if anybody has any kind of pain, we're really good. I consider us as like the primary care for figuring out what pain.
What the source is.
Exactly.
Well, here's the thing. For more information or to make an appointment, you can log on to painmm.com. Doc, thanks for coming in. We appreciate it.
Thank you very much for having
me.
Yeah.
Want to take a quick break?
Yeah, and I got to get a napkin. I got gel all over. Oh, thank you. More LEX 18 News at 12:30 coming up in a moment.
Imagine this is you.